ALS is a debilitating and deadly disease with no cure. There are some known genetic markers, but it's a tough choice. Find out your future risk and live with a looming diagnosis for years before the onset of symptoms, or go blindly through life not knowing you carry the gene. It's a dilemma facing one local family. Given the option, what would you do?
Each day. Some days are better than others. Mornings are terrible.
Candy Katsioumidis starts her day with medications.
So everything revolves around when I take my medication and when it kicks in.
She uses a chairlift to navigate her home.
My legs started first. I was tripping over my feet.
And a walker for shorter distances. But some of her challenges are less obvious.
I can talk and I can swallow, but my stomach is paralyzed and the bowel is paralyzed.
The 47-year-old relies on a feeding tube for nutrition and an ostomy pouch to bypass her intestine.
You hear a lot on TV about, the short term and, people that have a short period of time that are, imminently passing.
That's not the case for Candy and other patients like her. She's been living with ALS for 12 years.
It's one of the enigmas of the disease.
The majority of ALS patients, 85%, have sporadic disease, meaning there's no family history. But 15% have familial disease. And researchers have identified 30 different genes in which a mutation can be passed down and cause ALS. Some mutations lead to a slow progression, others to a faster course. What are called gene modifiers play a key role.
There's something in the background genotype which is affecting whether the disease will manifest or will not, and if it does, when it will manifest.
I have been to the hospital and seen doctors that have actually said to me, if you truly had ALS, you'd be dead. Mm-hmm. And I've actually had to show them the genetic test.
The mother and former physical therapist has an abnormality in a key gene linked to ALS, known as TDP43. Candy and her husband know their son faces a challenging decision.
I think back to it and think, if I were that age, would I have wanted to know? And no, because I wouldn't have, because I would have just wanted to go on with my life as a therapist and get married.
Having information about bearing a gene that can cause ALS is an extremely difficult and complex problem to think about. But on the other side, it may afford an opportunity to use a very specialized medication that's super targeted to that particular mutation or that specific gene. I'm cautiously optimistic that we are really getting close.
For me, it's been just keep me going. I just want to keep going. Whatever I need done, let's do it so that Candy can keep going and keep pushing forward.
To help answer some of the key questions, Dr. Kalb and his team are looking closely at genetically modified worms used to model the disease. They've identified genetic modifiers that improve their coordination, research supported by the Les Turner ALS Foundation. We have links on our webpage. Back to you.